Hospital intensive care units around the world report a sharp spike in patient deaths between 4 and 5 in the morning, every single night. The increase is so consistent across decades of medical data that doctors have given the phenomenon a specific clinical name used in cardiology. They call it the dead hour, and it is the most statistically dangerous 60 minutes of the entire 24-hour cycle of human biology. Roughly 30% more humans die between 4 and 5 a.m. than during any equivalent hour of the day or night anywhere on Earth. Heart attacks, strokes, respiratory failures, and sudden cardiac deaths all spike inside this narrow window with disturbing consistency every single morning. If you have ever been admitted to a hospital, you may have noticed nurses check patients more often during this exact window each night. Tonight we explain exactly why this happens, why your body is most fragile at this hour, and what is collapsing inside you right now. We will reveal the exact physiological state of your body between 4 and 5 a.m. and why every measurable system reaches its weakest point. We will explain why your heart, your lungs, your blood pressure, your immune system, and your cellular metabolism all hit minimum simultaneously. We will identify the medical conditions most likely to kill in this window and the demographic of humans most at risk during this hour. We will reveal the hospital protocols that doctors and nurses follow specifically because of this phenomenon during shift changes and ICU monitoring. And we will explain the evolutionary reason your body is biologically programmed to enter its weakest state at this exact hour every single night. The phenomenon is well documented in cardiology, internal medicine, and sleep research literature, spanning decades of statistical and physiological studies. By the end of this video, you will understand why your great-grandparents called it the hour the angels come, and why they were right. And you will know what to monitor in yourself and your loved ones to navigate this hour safely if you are at elevated risk. To understand why this hour is so dangerous, you must understand what your body is actually doing between 4 and 5 in the morning. Your circadian rhythm runs on a roughly 24-hour cycle. Predictable peaks and valleys in every measurable biological system in your body. Some systems peak in the morning, others in the afternoon, and a few specifically reach their absolute lowest point during the early morning hours. Your core body temperature follows a circadian curve that peaks in late afternoon and reaches its lowest point at roughly 4 a.m. every night. By 4 a.m., your body temperature has dropped approximately 2 degrees Fahrenheit below your daytime baseline, slowing every cellular process measurably. Your blood pressure follows a similar curve, reaching its lowest point at this same hour, sometimes dropping 20 points below daytime levels. Your heart rate slows to its absolute minimum, often dropping to 50 or even 40 beats per minute in healthy adults at this window. Your breathing becomes shallowest at this hour, with respiratory rate at its lowest of the entire day, oxygen exchange at its slowest functional level. Your blood is also at its thickest at this hour, having been still for hours of deep sleep without movement to circulate it properly. Thick blood combined with low pressure and slow heart rate creates the perfect storm for clot formation, particularly in vulnerable cardiovascular systems. Your immune system follows the same circadian dip, with white blood cell activity reaching its lowest point during this exact same time window. If your body needs to fight infection during this hour, it has fewer resources to deploy than at any other moment of the day. Your kidneys filter more slowly. Your liver processes more slowly. Digestive system has essentially stopped, all functions at maintenance level. Cellular metabolism across your entire body has dropped to its lowest measurable rate, every cell saving energy for the eventual morning wake response. From a medical perspective, your body at 4 a.m. is closer to its biological floor than at any other moment of any other day. It is not yet death, but it is the closest your body comes to death every night, the lowest point of the biological cycle. For a healthy young adult, this floor is still well above any dangerous threshold, and the body recovers without any noticeable issue. For an older adult, a sick adult, a weakened heart, or compromised immune system, the floor itself is dangerously close to medical failure. If a body is already weakened by disease, age, or recent surgery, the additional physiological dip of the dead hour can be lethal. This is why hospital ICUs schedule increased nurse rounds, extra monitoring, and active patient observation specifically during this hour every single night. Cardiologists have specifically documented that heart attacks cluster at this hour, with morbidity peaks between 4 and 5 a.m. in every long-term study. The combination of thick blood, low pressure, slow heart rate, and the imminent cortisol surge creates ideal conditions for cardiac event triggering. The cortisol pulse we discussed in an earlier episode arrives at this same hour, forcing a fragile heart to suddenly accelerate cardiovascular activity. For a young, healthy heart, the surge is smooth and unnoticed. The body transitions effortlessly into morning. No medical event of any kind occurs. For an old or weakened heart, the surge is the load that finally breaks the system, triggering arrhythmia, infarction, or sudden cardiac death. Strokes follow the same pattern, with peak incidence between 4 and 5 a.m. in cerebrovascular research data across hospitals on multiple continents. Sleep apnea episodes also peak in this window as muscle tone is lowest and breathing patterns most fragile, increasing oxygen deprivation risks dramatically. For patients with chronic obstructive pulmonary disease, this hour represents the highest mortality window of the entire day-night cycle on average. Asthma attacks peak in this window for similar reasons, with airway resistance at its highest and respiratory capacity at its lowest physiological point. Diabetic patients often experience dangerous blood sugar dips in this hour, requiring careful overnight monitoring to prevent hypoglycemic medical emergencies. For elderly patients with multiple chronic conditions, the cumulative effect of every physiological system hitting minimum simultaneously is genuinely life-threatening. Hospice nurses report that the 4 to 5 a.m. window is when the majority of expected end-of-life passings naturally occur in their patients. The phenomenon is so well documented that hospice care protocols specifically prepare families to expect the passing during this window if death is imminent. For surgical patients in recovery, the dead hour is the period of highest postoperative complication risk, especially for cardiac and pulmonary surgical patients. Hospital shift schedules deliberately overlap nurse and physician coverage during this window, ensuring maximum medical response capacity during the most dangerous hour. ICU monitoring intervals decrease from every 15 minutes to every 5 minutes during this window for critically ill patients across most hospitals worldwide. If you have ever been hospitalized and noticed nurses checked on you more frequently in the early morning, this is the explanation behind it. The hospital was not being attentive randomly. The medical staff was specifically protecting you from the statistical risk window of the dead hour. The phenomenon is taught in every medical school in the developed world as part of basic circadian medicine and cardiology curriculum standards. Doctors and nurses know about the dead hour, but most patients and most general public have never heard the term used clinically before. The obvious question is why evolution would design human biology to reach its weakest state at a specific predictable hour every single night. The answer involves the deep history of human ancestry and the conditions under which our species' sleeping patterns originally evolved millions of years ago. Throughout most of human evolution, the 4 to 5 a.m. window was the safest possible time for the body to maximally rest and repair itself. Predators that hunted humans were primarily active at dusk and dawn, with the deep middle of the night being safer than either transition zone. 4 a.m. was deep enough into the night that nocturnal predators had already eaten or returned to their dens for the remaining hours. It was also still far enough from dawn that diurnal predators had not yet emerged from their dens to begin hunting for the day. This narrow window of relative safety was when the body could afford to enter its deepest, most repair-focused state without significant predation risk. Evolution therefore selected for circadian rhythms that pushed maximum cellular repair, immune rebuilding, and hormonal reset into this safest window each night. The cost of this strategy was that the body became maximally vulnerable to internal medical failure during this same window, a trade-off evolution accepted. For most of human history, cost was negligible. Healthy young adults sailed through the dip without consequence and woke refreshed the next morning. But modern medicine has now extended human life into ages where the body itself is the primary threat, not external predators in the dark. An 80-year-old human in a modern bed is no longer threatened by predators, but is more threatened than ever by his own circadian dip. Evolution did not anticipate that we would live long enough for our own biological cycles to become a greater risk than any animal outside. And so we continue to enter the deepest physiological dip every single night, exactly when our older bodies are most likely to fail completely. The hour our ancestors evolved as the safest hour of the night has become, for modern aging humans, the most dangerous hour today. Statistical evidence confirms this paradox every single year in mortality data published by national health agencies across the world. More humans die between 4 and 5 a.m. than any other hour, and the cause is biological design, the slow exit of the body. If you are at elevated medical risk, there are several evidence-based steps shown to reduce dead-hour mortality in clinical research literature. First, sleep on the side rather than the back, which improves breathing and reduces apnea risk during the most vulnerable hour of the night. Side sleeping is associated with statistically lower nighttime mortality, particularly for patients with sleep apnea or cardiovascular disease underlying conditions. Second, maintain consistent room temperature between 65 and 68 degrees Fahrenheit, which supports natural body temperature dip without triggering hypothermia stress. Third, hydrate consistently throughout the day so blood is not maximally thick during the overnight period of minimal circulation, reducing clot risk. Fourth, avoid heavy meals within 3 hours of bedtime, which forces digestive activity to continue during a period when the body needs rest. Fifth, avoid alcohol before bed, which suppresses breathing and increases sleep apnea severity, specifically during the most vulnerable physiological dip. Sixth, treat any underlying sleep apnea aggressively with CPAP or other prescribed devices, as untreated apnea significantly increases dead-hour mortality risk. Seventh, address chronic cardiovascular conditions with the medical adherence prescribed by your physician, since most dead-hour deaths involve heart system failure. Eighth, if you live with an elderly or chronically ill loved one, consider checking on them once during the early morning hours each night. Many hospice and home care families adopt the practice of an overnight check during this window, which has been credited with saving lives in studies. These steps will not eliminate the risk of the dead hour, but they will reduce the probability of being one of the statistics yearly. For healthy young adults, the dead hour is simply a biological curiosity. Your body dips and recovers without you ever knowing it happened. For elderly humans or those with serious conditions, the dead hour is the single most dangerous medical window of the entire 24-hour cycle. Knowing about it does not change your biology, but it does change how you and your loved ones approach the early morning hours. Awareness of the phenomenon is the first step toward prevention, monitoring, and intervention when intervention becomes possible during this window. Tonight, when you fall asleep, your body will begin its gradual descent toward the 4 a.m. minimum, just as every night of your life. Your temperature will drop, your pressure will fall, your heart will slow, your immune system will dim, your blood will thicken in your veins. Somewhere between 4 and 5 a.m., you will reach the lowest physiological point your body experiences across the entire 24-hour cycle. If you are healthy and young, you will pass through it without any awareness, recovering normally with the cortisol surge that follows shortly after. If you are older or have an underlying condition, this is the hour to monitor, the hour evolution designed safe but modernity made dangerous. Your ancestors called this hour the angels come, and they buried more of their elderly relatives during this window than any other. Doctors call it the dead hour, and statistics confirm it every single night across every hospital on Earth. Your body is most fragile then,